right, we are live. Welcome, everybody. Thanks for joining us. My name is Zach Veers. I'm the clinic owner and therapist here at Egoscue of Seattle. And this is Martin McFarland, owner of the Egoscue Portland Clinic. So we're here
Hello.
to, yeah, thanks for joining us. So we've got some questions. Some of you have submitted ahead of time, so we're gonna get right into that. And then if you have any questions, please put them in the comments below. We'll try to get to them. Or if you're not able to watch this live, if you're watching this later, you can still put comments in there and we'll get to them in our next video. So we'll be trying to do this more often. So yeah, let's get right to it. So first question I had was someone was asking about TMJ, which for those of you who don't know, it's the joints kind of right here attaching your jaw to your to the rest of your skull, and the painful sore area. And specifically, she asked if there's exercises that can be done to help that. Her dentist wanted to do like a custom mouth guard that was going to cost like $1,000. So she was just seeing if there was anything that could be done for that. So Martin, do you want to tackle that first?
I would say the first thing that we would look at is head position, right? As it relates to, the neck and shoulders and jaw. Typically when people come in and they are presenting that pain, oftentimes they're going to have a forward head. And then we have to, dial it back and say, okay, how come their head is in a forward position, right? And so we have to treat the body as a unit. Is it a dysfunction in the hips that's causing rounding in the upper back, thrusting the head forward?
Yeah.
So
that's a really good point. I think a lot of people nowadays are actually pretty aware that like forward head posture is a bad thing. Like it's becoming more common, which is great, that people are aware of posture. But I think they usually get hung up on, okay, my head is forward, so therefore I need to do like chin tucks and neck exercises to get my head in alignment. But as you mentioned, like you have to look at the whole body, right? Because the head's going forward. It's usually not just on its own, right? There's usually something else going on.
that's exactly right. And what we've found is, you can do all the, head and neck exercises, in the world, but it's not going to change until you change the position of the upper back and the hips to support, the change that you're asking for in the head and neck. Right? You can do this and this and this and this and this, forever, and you're not going to get a lasting change until you change the spine and the hip position.
Yeah. So what's a common, what would you say is a pretty common posture that you associate with TMJ, if there was one?
Yeah, I would say flexion or rounding in the upper back. And again, that forward head position and the hips, pelvis being tipped posterior or backwards, right? Not supporting the low joints, above. So your body loses the vertical positioning. That's right. And then the upper back rounded. That's right.
So
I would say that's the most common.
yeah, hips forward of the gravity line, pretty typical. So yeah, so as far as exercises go, yeah, there's definitely things you can do, but once again, it's going to be personalized based on the individual. So there's not really one thing you can do for everybody, but just as a little maybe functional test I like to give is have people go stand up against a wall, like put their heels, their butt, their upper back, and if they can, their head on the wall, and just get your feet pointed nice and straight and just stand like that. And if I mean, that should be relatively easy if your body is more or less in alignment, right? But as you'll see, if your posture, yeah, exactly. So if you have those postural issues Martin was talking about, then you're going to have a hard time keeping all those parts of your body on the wall. Your head's not going to want to go against the wall. You'll feel like you have to really lean back, and then it just puts all this strain on your neck. So if you can, I would to the person who asked that question, I would go standing up against the wall, see how easy that is for you. If you have any troubles, or maybe you notice like, hey, one of my shoulder blades or one of my hips touches the wall easily, but the other one seems like it's forward, like that's another clue that there might be some rotation going on too. So yeah, so give it a shot. Hopefully that answered your question about the TMJ. Let's see. The other question I got was about feet. So going to the other extreme of the body, feet, arches. I get this question quite a bit actually, is people who've been told they need arch supports or custom orthotics, in their shoes. That could be because of low arches, high arches, bunions, hammer toes. I mean, there's all kinds of reasons someone would have those. But I guess, so the question is that necessary? Do I need fancy arch supports, or can Egoscue help those conditions? So I would say, just from personal experience, so I actually, Martin, if you remember when I first started working in Portland with you, there was, I was wearing, like, I think I still had my orthotics, and I had like definitely really supportive, like chunky athletic shoes. So that changed pretty quick after, I think you were wearing like the Vibrons probably at the time, or Vivos.
Throw those shoes away.
Yeah. So I guess, so background is I don't know if I've always, I mean, at least since teenage years, had pretty flat arches. And so at some point, I think my dad had me do a consult with a PT, and they, recommended I get arch supports. So it's like, okay, makes sense. Feet are flat, need to support them. So we got custom orthotics, and I wore those for several years through college, and then up until I started working at Egoscue. And so basically, my opinion on the arch supports is that they while they support your foot in a better position, it's just a temporary fix. It's like wearing a cast. It puts your joints in a better position, which maybe is helpful for some scenarios in a short term. But what happens when you support a body part and don't allow it to move, right? What happens if you put your cast, you break your arm, or you wear a cast for a while? The muscles atrophy, they get smaller, they get weaker because you're not using them, you're not moving the joint. So I think the same thing happens with our feet. We're wearing those rigid supports. Our arch is now, yeah, it's lifted up, but it's not the muscles doing the job. It's this piece of plastic or whatever. So, and then you rely on that for years and years. And what happens? I think your feet just get worse. I know mine did. My arches never got better. I think they probably deteriorated more. So I'm not saying everybody should just go out and throw their orthotics away like I did, but it's a process. And over time, I switched to more minimalist shoe and doing Egoscue exercises. Yeah, there we go. Oh, you got the limbs. I still wear Vivo barefoot. I love showing these off because it's pretty fun. There's nothing to them. They're flexible, they're thin. Definitely no arch support there. So it's basically allowing your foot to function as if it was barefoot, without any restriction. Toes are allowed to splay. The arch is allowed to actually move and absorb, forces like it's supposed to. And then it definitely requires your feet to do more work. So, they get stronger. And so my arches have actually gotten better over the years that I've been doing this. In fact, maybe I'll see if I can pull up that picture. I took some before and afters.
Photos, yeah.
Yeah.
And I think we should clarify, Zach, that, that transition from a supportive stiff shoe with orthotics to a more minimalist shoe can take a while. And you want to be very careful in that transition. Like, you don't want to buy barefoot shoes and then go for a run. Right? That'd be a real shock, to the body, and you don't want to get injured. So that transition can sometimes take, 3 to 6 months. The other thing that we tell people when they've been wearing stiff-soled shoes and orthotics for a long time is as you start to realign your body, those orthotics will become uncomfortable,
Hmm. Right. Yeah,
right?
that's
'Cause
good.
it's trying to change them, into a position that's unfamiliar now because your body's, functioning how it's designed. So people always say, well, when can I take them out? And we usually tell them when they start to become uncomfortable because your alignment is changing. That's how you know that you're ready. And it might not be for the whole day, it might be just for a couple hours at a time. So you just want to be really gentle in that transition. But we have seen it happen over and over again, over the course of, 2 decades of doing Egoscue, that you are able to get out of those.
Yeah. No, excellent point. I think that's where a lot of people go wrong, and then they blame the shoes, or they think that minimalist shoes are bad for them because they switched like cold turkey basically, right?
Right.
And you took this foot that's been used to having this support for years, and now you ask it to like basically be on its own without any kind of support from the muscles or the joints above it. And yeah, you're bound to get stress fractures, or pain or something. So still just here I found the picture. So let me see if I can screen share. This is on our Facebook page too. If you, I posted it a couple years ago, but if you, let's see if this works. Okay, you see that hopefully. All right, so these are my beautiful
It's a
ankles.
great before and after photo.
So I mean, you can see this was over a 4-year span, and now I don't know if it took 4 years to make that change. Those were the, I tried to find the oldest picture I had, and then I took a recent one. So you can see on the bottom there, like it's not perfect. Like my arches still aren't great, especially on the left side, but compared to what they were up here, that's pretty. You can just look at the angle of that Achilles tendon, like bowing in there, because that ankle was pretty flat. And the right side too, not as severe, but definitely collapsed. And you can actually see some arch there now. So that was a couple years ago. I should get
Yeah.
some new.
Great work, Zach.
But yeah, it was all thanks. I mean, you really turned me on to the minimalist shoes, so I've never really looked back since then. Okay, cool. Oh, and I guess the same thing I would say applies, to that. Talking specifically about flat arches, but I would say the same thing about high arches. Some people have that problem, wear supports, and once again, like I think if you get your body in better alignment, and if you get a shoe that allows the foot to function like a foot, um, you know that that can be doesn't have to be a problem or painful either. So once again, like you said, be smart about it. It's going to take slowly transition. Don't just try to switch overnight because you'll be regretting it. So let's see. The other question we had was, maybe you can address this, Martin. Should I do the exercises? I'm assuming the Egoscue exercises if there's pain, if it hurts.
That's a great question. And as you're going through the Egoscue exercises, I always tell people the most important thing is to, tune into your body. How is it feeling? What is it telling you? So if you're doing an exercise and you feel some stretch or tension, or even a little discomfort, some slight pain, I would say that's fairly normal, right? And so oftentimes as you hold the position, or you do more repetitions, things tend to loosen up, right? You get some more blood flow to that area, the muscles, the fascia, everything starts to let go, and it gets more fluid. What you don't want is, you don't want to get into a position, and like on a scale of 1 to 10, it's a 7 or 8 or 9, like a stabbing pain. That's your body telling you that you're not quite ready for that. And also, what you don't want is, you don't want to be experiencing pain or tension 3 or 4 hours later in a specific area, right? So a little discomfort as you're doing the exercise, that's pretty normal, right? But you don't want to feel that tension or pain, hours later, or, it shouldn't, wake you up in the middle of the night. right? That's when you want to make a change. And so most of our exercises, we're able to modify, so they're more specific to the individual, and maybe it's just a slight positional change. And also you want to make sure that you're doing the exercise correctly. You want to make sure that you're watching the videos, and following the instructions, and then if you need more instruction, don't hesitate to reach out to us. I always tell our clients, communicating with us, emailing, calling, we don't want you to feel like you're bothering us. We're talking with people all day long because we want you to maximize the benefit of your exercises and to get the most out of it. So if you have questions, please, reach out and connect.
Yeah. How many
Anything to add to that?
I was going to say, how many times does this happen to you? You give someone an exercise that, feels great when they do it in the clinic. Everything looks good. And you send them home with their homework, and you get a phone call a couple days later and it's like, Martin, this exercise is really hurting. I don't know what's going on, but I can't walk now, and then so you're like, okay. And I mean, most of the time you get them back in the clinic or get on Zoom and see what they're doing. And it's like, they're doing something completely wrong, like not. So, I mean, it's understandable, right? You go through so much stuff, especially on a new visit, brand new client, like there's so much information on that first visit. And so it's hard to remember all those details. And even with the instructions in our app or from the email or the print off, those little details make a big difference. So yeah, making sure you're doing it correctly. And assuming you are, if it's still causing you pain, then like you said, I think it just means your body's, for whatever reason, is not ready for that. Doesn't mean it's bad exercise or that you can't do it in the future. Just means we need to change something, prep your body a little bit better. Maybe something's not working like it should. So we need to address that so that it becomes less painful, right?
Right. And on the other side of that coin, how many times have you experienced, a client coming in and you try and exercise and they can't do it because it's uncomfortable or it's painful, and you say, okay, let's wait. And then they'll try it anyway, right? And then, after a few days, then they can do it. Yeah. Right? Like, oh, that doesn't hurt anymore. I would say that happens quite a bit.
Yeah, that's right.
That happens quite a bit as their body, unlocks. And the advantage to coming in, that's why I really like reviewing the exercises when people come in on their follow-up visits, is because we're able to see their body from a bird's eye view, right? So sometimes people think their, foot's here when it's really here. And then we can help them, kinesthetically, make those adjustments and changes.
That brings me to another question I get asked a lot is, okay, so the form is really important. Can you, especially nowadays with COVID and doing a lot of things virtual, is it still effective on Zoom? Can you still see what you need to see? Can people still get help virtually if they can't or maybe don't feel comfortable coming into the clinic in person?
Yeah, absolutely. One thing to keep in mind is, we've been using the Skype platform ever since it came out. I mean, is that 10 years ago, maybe?
Yeah, something.
Or more. So we've been doing digital therapy for a long time. And so this isn't, new for us. I've had a lot of clients that I've never even met in person.
Yeah,
who have had, amazing results. And so it's a great technology. Clients love it because they don't even have to leave their house, right? They don't have to, sometimes driving is painful. They don't even have to drive, right, to come to an in-person appointment, right? Yeah. So they can get the help they need and they can do it right from their, living room.
Yeah, and the other thing I like about Zoom is it allows us to see them in their own environment, yes. Like in the clinic, we've got all this open space, we've got bare walls to use, we've got the equipment, and at home, most people don't have that luxury. So, you have to modify and do it differently. So it's good for us to be able to see exactly how you're doing it because, like we were talking about earlier, you may be doing something not quite proper. And so being able to actually see that and exactly the way you're doing it at home is actually really helpful. So
Yeah, good example of that is like static back. You know, we have these perfect blocks in the clinic,
Mhm.
and you go home and you might be doing static back on your couch or maybe using an ottoman. And
Yeah.
so when we do a digital session, we're able to see, okay, is it the right height?
Mhm.
You know, how does the positioning look?
So I'm probably right now, I'm probably like a quarter of my clients are in-person visits, and the other 3/4 are still on Zoom. What is it? Is that similar for you, or how many? What's your?
No, we're definitely seeing more people in person. I would say, yeah, at least 50%
Mhm.
um, digitally. And I'd say my wife, Kelly, I'd say she's probably 75% in person.
Yeah. Cool. Yeah. So both options work great. You
Yeah.
know, there's if you're too far from a clinic, that's totally fine. You know, we can help you on Zoom or FaceTime. And then, but we're also open to see people in person. So it's one-on-one. You know, we follow the safety precautions and wearing masks and stuff. So you have both options, and I would say both are equally as effective. You know, it doesn't really matter to us. Um, I like seeing people in person, but you know, like I said, there's benefits to both. As long as you got a decent internet connection and a camera on your device, which most people do, it's just fine. So
Yeah. A little fun fact here, Zach. You remember my farthest digital session was New Zealand.
yeah,
I worked with a woman for many, many sessions, and
yeah.
yeah, never met her in person.
So the time difference was probably pretty crazy to figure that out, right? Like,
And a different day because it's across the international date line. So that was fun trying to schedule the follow-up appointments.
I had, I guess my farthest recently, I had a guy in Seoul, South Korea. So
Yeah.
that was fun. So yeah, do Egoscue anywhere. um, I'm just checking to make sure we didn't have any other questions on Facebook. Not yet. Doesn't look like. So well, cool. I think that good sums up all the questions we had before. Are there anything else you want to add or questions you got?
No, let's get out and enjoy the weekend, move your body. We've all been stuck at home way too long.
Yeah, do your exercises.
Do your exercises, go for a walk, go for a hike. Let's get out and get some fresh air.
All right, cool. Well, thanks again, everybody who submitted questions, and thanks, Martin, for doing this with me. And we'll try to be doing this a little more often. And so I love interacting with clients this way and getting questions answered. So please submit more. You know, put them in the comments, shoot them to us in email, or instant message us, and we'll be happy to answer them in the next session. So keep your eyes open for when we schedule that. So. All right, everybody. Thanks. Take care.